This recording will go over seizures and epilepsy. A seizure is an abnormal, sudden, excessive, uncontrolled electrical discharge of neurons within the brain that may result in a change in level of consciousness, motor or sensory ability, and/or behavior. A single seizure may occur for no known reason. Some seizures are caused by pathologic conditions of the brain, such as a tumor, and then when the underlying problem is treated, the patient is often asymptomatic. We'll review some other types of causes for seizures momentarily. Epilepsy is defined by the National Institute of Neurological Disorders and Stroke as 2 or more seizures experienced by a person. It is a chronic disorder in which repeated, unprovoked seizure activity occurs. It may be caused by an abnormality in electrical neuronal activity, an imbalance of neurotransmitters, especially GABA, or a combination of both. Seizures are classified as generalized seizures, partial seizures, and unclassified seizures. 5 types of generalized seizures may occur in adults and involve both cerebral hemispheres. The tonic-clonic seizure, lasting 2 to 5 minutes, begins with a tonic phase that causes stiffening or rigidity of the muscles. And with tonic phase, I think of muscle tone. So when my muscles are really toned, they're rigid and stiff. This tonic phase affects particularly the muscles of the arms, and they become stiffened and rigid, and also can affect the legs and cause an immediate loss of consciousness. Clonic or rhythmic jerking of all extremities follows. So the tonic is the tensing up, and then the clonic is the jerking that most people associate with seizures. The patient may bite his or her tongue and become incontinent of urine or feces. Fatigue, acute confusion, and lethargy may last up to an hour after the seizure. Occasionally, only tonic or clonic movement occurs. A tonic seizure, so we know that tonic is the tone, right, is an abrupt increase in muscle tone, loss of consciousness, and autonomic changes lasting from 30 seconds to several minutes. The clonic seizure, lasts several minutes and causes muscle contraction and relaxation. So that'll be the twitching you'd see, the twitching that you'd associate with seizures. A myoclonic seizure causes a brief jerking or stiffening of the extremities that may occur singly or in groups. Lasting for just a few seconds, the contractions may be symmetric, both sides, or asymmetric, only one side. Finally, in atonic or akinetic seizures, A meaning without, tonic meaning tone, the patient has sudden loss of muscle tone lasting for several seconds, followed by post-ictal meaning after the seizure, confusion. In most cases, these seizures cause the patient to fall, which may result in injury. This type of seizure tends to be the most resistant to drug therapy. Another classification of seizures is the partial seizure. Partial seizures are also called focal or local seizures because they begin in a part of one of the cerebral hemispheres. They are further subdivided into 2 main classes: complex partial seizures and simple partial seizures. Complex partial seizures may cause loss of consciousness or syncope or blackout for 1 to 3 minutes. Characteristic automatisms may occur as in absent seizures. Automatisms are non-purposeful repetitive behaviors such as lip smacking, chewing movements, blinking of the eyes, or rubbing fingers together. The patient is unaware of the environment and may wander at the start of the seizure. In the period after the seizure, he or she may have amnesia or loss of memory. This type of seizure, complex partial seizures, are most common among older adults. They're difficult to diagnose because the symptoms appear similar to those of dementia, psychosis, and other neurobehavioral disorders, especially in the post-ictal stage, the stage after the seizure. New onset of seizures in older adults are typically associated with conditions such as hypertension, cardiac disease, diabetes, stroke, dementia, and recent brain injury. The patient with a simple partial seizure remains conscious throughout the episode. He or she often reports an aura, an unusual sensation, before the seizure takes place. This may consist of a déjà vu phenomenon, perception of an offensive smell, or sudden onset of pain. During the seizure, the patient may have one-sided movement of an extremity, experience unusual sensations, or have autonomic symptoms such as increased heart rate and increased blood pressure, as well as epigastric discomfort. Unclassified or idiopathic seizures account for about half of all seizure activity. They occur for no known reason and do not fit into the generalized or partial classifications. Primary or idiopathic epilepsy is not associated with any identifiable brain lesion or other specific cause. However, genetic factors most likely play a role in its development. Secondary seizures result from an underlying brain lesion, most commonly a tumor or trauma. They may also be caused by metabolic disorders, acute alcohol withdrawal, electrolyte disturbances, high fever, stroke, head injuries, substance abuse, and heart disease. Seizures resulting from these problems are not considered epilepsy. In terms of assessment, it's important to know how long the seizures have lasted, how many have occurred, if there's been more than one, how much time has gone by in between the seizures, has there been a pattern of occurrence. So if you're working in the emergency room and a patient comes in with a family member, those are the things you want to ask. If you're on the floor and your patient starts having a seizure, those are the things you want to watch. So you walk in there having a seizure, you want to know the time, because we're going to want to know how long the seizure lasts. You're going to want to know what was occurring, right? Because there's different types of seizures. So was it tonic-clonic? Was it one or the other? Was it atonic? So just we want to describe as best we can what the patient looked like when the seizure was going on. Was there a loss of consciousness is a big one. Did the patient experience an aura prior to the seizure? What prescription meds are they taking? Are they taking any street drugs or alcohol? Have they had a head injury? Have they had a high fever? That is particularly important for children who usually are the ones that experience febrile seizures. They get a very high fever, they end up having a seizure. As long as fevers are controlled, they don't have the problems with the seizure. And then what's the patient's medical history? Signs and symptoms, again, vary based on the type of seizure. Diagnosis is based on the history and physical examination. There are some tests that are performed to rule out other causes of seizure activity and to confirm the diagnosis of epilepsy. Typical diagnostic tests include an EEG, a CT scan, an MRI, or a SPECT or PET scan. Laboratory studies are performed to identify metabolic or other disorders that may cause or contribute to seizure activity.